CDC officials did brief media on the hantavirus situation in the U.S. They said there are no cases of the virus infection in the United States and that they are monitoring 41 people who had exposure to the hantavirus.
We turn now to somebody we talk to regularly during the COVID pandemic. Back with us, Dr. Amesh Adalja, senior scholar at the Johns Hopkins Center for Health Security, also an adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health, an affiliate of the Johns Hopkins Center for Global Health. His work focused on emerging infectious disease, pandemic preparedness, and biosecurity. I was joking when you came in the studio. I mean, we literally, we were talking to you every week for, 18 months, just a few years ago. You're the perfect guy to have back to talk to us about hantavirus. Are we entering another phase like COVID?
No, we're not, because these are very distinct viruses. There's two different viral families, two different set of biological characteristics, and it's not that every virus can cause a pandemic or even an epidemic. And hantavirus is one that has very constrained ability, even the Andes virus, to spread from person to person. It's not as contagious as COVID, not as contagious as flu. So we will have a public health emergency. We've got work to do, but it's not something that's going to threaten the general public.
But for some people, it can be, people have lost their lives, right?
Exactly. Pound for pound, it is a very virulent virus. But just because something is virulent doesn't make it more transmissible or make it something that can cause an epidemic. There's many diseases like Ebola, for example, or rabies is a great example, basically 100% mortality, but it doesn't pose a threat to the general public. So while people who get infected with hantavirus have a mortality rate of maybe 1/3, it's not something that spreads through a population very easily, if at all.
You know, we had this story yesterday in Bloomberg, and it was about Chilean scientists who, for years, were working on a vaccine. And actually, just before the pandemic, they couldn't find the $7 million that they needed to continue with clinical testing. So they kind of put it aside. And a lot of people are asking questions right now, like, oh, maybe a vaccine should have been developed. Given how rare this is, but how fatal it is this something that scientists should work on creating a vaccine for?
I always like to see more vaccines being made for everything, but you have to recognize the economic reality of the issue. If there's not a return on investment because the market size is so small, because there's such a small number of people that get hantavirus, biotech, pharma, they're not going to be interested. So what we have are multiple vaccines kind of in phase 1 level studies, and they need a lot more money, probably $1 billion or so, to get all the way to phase 3. Wow. There may be interest now in doing that, but it wasn't something that was high on the threat radar compared to avian influenza, for example.
I do remember during the COVID pandemic, Dr. Adalja, that we talked a lot about, is this just the first of many? How do you look at global pandemics and what might come in our lifespan still?
There's not some special clock where it says, oh, it's time for a pandemic and one happens, like 1918, 2019, maybe 100 years, but that's not a real hard and fast rule. It has to do with the way we live. Megacities, travel, interfaces with animals, interfaces with the environment, all of that plays a role. And obviously those pressures are getting more, and travel times are shrinking. Megacities are getting bigger, animal interactions more. So that increases the risk of a pandemic. But you have to also remember that we've got technological and innovative solutions that kind of allow us to master that problem. And we're increasingly being able to master that problem with things like mRNA vaccines if we have the will to deploy them.
Okay, if we have the will to deploy them, which is probably a perfect segue to helping contextualize this for us. A general American, should we be more worried about the hantavirus, or should we be more worried about pockets of measles outbreaks in the U.S.?
Pockets of measles outbreaks in the U.S. are definitely more worrying. That actually causes the general American to change their behavior. Measles is reestablishing endemicity. We're likely to lose elimination status. We've already had 3 deaths from measles in 2025. This is unheard of.
Do those deaths prompt Americans now to pay attention and say, wait a second, maybe the move away from vaccinating young children was not the right move?
Some of them do, but some of them are they're really stuck in the mud here, and they won't move. It's an entrenched view, especially from our Health and Human Services Secretary, who has been anti-vaccine for decades and decades. So it does move the needle literally in some people, but not everyone.
But I have noticed that he is speaking out less now on hantavirus, for example.
That's a good thing. We don't actually want him, or I don't want him to speak about hantavirus, but maybe that's because they recognize they have to do this competently, that they have to have the confidence of the American public, and they know that RFK Jr. is not somebody that instills confidence. He plays to his crowd, his anti-vax crowd, and that has no place in what's going on now with hantavirus. So the less he speaks, the better the response will be.
How does the medical community, or at least from your group, of medical professionals that you speak to, how do they see this administration? How do they see this particular health secretary in terms of his impact longer term? Or do you think it's just this administration, and then when a new administration comes in, things can change again?
No, I wish it were that. I think that he's done so much damage. Some of it will be irreparable. If you look at the CDC, completely decimated, budget cuts, people quit, people were fired, the place was shot up by a gunman. All of that is going to be hard to recover from. And it's also the fact that when it comes to vaccine architecture and the ecosystem, he basically knew where all the pivot points were, and he's dismantled the entire ecosystem in terms of the advisory committee on immunization practices, the way the vaccine courts are run, all the cronies he's installed, and all the mistrust and distrust. He's done so much damage that I don't know that we come back from this very quickly.
What's the impact on American health?
It's going to, we're already seeing it. Measles outbreaks all over, pertussis outbreaks everywhere. We're worried about diphtheria. We're worried about many different vaccine preventable diseases. And our pandemic preparedness is in shambles. The mRNA vaccine contracts that they had signed with Moderna, that HHS had signed, he canceled all of that. He said we need to take a pause on infectious disease. He's put his own people in at NIH and other places, and it's really dismantled the entire way that we think about infectious disease preparedness.
You know what's noticeable, I think, is how during the Biden administration, and when we spoke to you quite a bit during COVID, there was a lot of concern from people on one end of the political spectrum, distrust coming from the government, distrust of vaccines. Now it seems like a completely different political spectrum is being is questioning this administration. So it seems like there's this question about public health and messaging, no matter who's in power.
That's exactly the worst case scenario. Now public health and infectious disease preparedness is a political issue. There's a Republican version of it, a Democrat version of it. It's gotten sucked right up into tribal politics like everything else in life. And now you have a Republican CDC director, a Democrat CDC director, and they're not going to be the same thing. And that's not how you manage an infectious disease. An infectious disease doesn't care who's in political power.
Just got 30 seconds left. Could the Hantavirus mutate to become more contagious?
There's no evidence that this is mutating. All viruses mutate, but there's no evidence that there's any kind of mutations going on that could make it more transmissible.
Thank you. Thank you. We have been talking about this in the newsroom and just trying to get a good feel of it. Dr. Amesh Adalja, thank you so much. Senior scholar at the Johns Hopkins Center for Health Security, adjunct assistant professor at the Johns Hopkins Bloomberg School of Public Health. Of course, the Johns Hopkins Bloomberg School of Public Health, supported by Michael R. Bloomberg, the founder of Bloomberg LP and Bloomberg Philanthropies. Thank you. Thank you.